PMS stands for premenstrual syndrome. So PMS describes a condition that lots of people experience and that has a lot of different symptoms, including some physical symptoms and some emotional and mood symptoms.
Some of the emotional symptoms can be change in mood, irritability, difficulty in sleeping, change in sex drive, change in appetite, being a bit more prone to perhaps weeping. They're some of the emotional symptoms.
The physical symptoms of PMS again vary, but can be things like bloating, cramping pain, tummy pains, sore breasts, spottiness.
A lot of these symptoms obviously are normal to a degree, and so sometimes it's only afterwards that someone will look back and say, actually, I was having more of those symptoms than usual, or they were more severe than usual, and they will then realise that that's what it's been.
And all of these symptoms tend to resolve as when the period comes, or get better when their period arrives. At different times of your lives you might experience that differently, but it can happen at any time of a person's life when they're getting periods. It tends to go away during pregnancy, when someone's pregnant, because obviously they're not getting periods, but it can get much worse around the time of the perimenopause or coming up to the menopause. That's something we quite often see.
Yeah, PMS can interfere with a woman's life and also on those around her. It may affect relationships through the changes in mood and emotional changes. It can be a problem for professional relationships, and it can affect relationships with partners through some of the physical symptoms that are occurring.
Everybody experiences PMS differently. Some people have no symptoms, some people have very mild symptoms that they might notice but they might feel are easy to deal with in their day-to-day life. Managing your own symptoms, there's lots of different things, and again, everybody's going to feel differently and find some things more helpful than others. A lot of things is really simple, like just looking after yourself.
Taking more exercise, getting outdoors in the fresh air, some walking, some running, some cycling, looking at what we're eating, making sure we're eating a good balanced diet, that we're getting plenty of sleep, that's really important. Cutting down on alcohol at those times, and also not giving into those food cravings, particularly those carbohydrate food cravings in the lead up to the period. Many women will tell us that by doing this alone they can really improve their symptoms.
If you were to get sore breaths or crampy tummy pains in the run up to your period, simple things like paracetamol and ibuprofen can often be really helpful. Vitamin D is something that can be helpful for PMS, and you can buy that at a pharmacist. And then the other one is something called Agnus castus, which is a herbal remedy. And there is some evidence that can be really helpful for some people with PMS symptoms too.
So I think if you've been undertaking all the self-help and it's really not improving, then that's the time to have a conversation with your GP, because there are medical treatments that can help. A commonly used treatment is a combined contraceptive pill, the pill that contains both estrogen and progesterone, because it can control the menstrual cycle, it can even out the hormones, and it can also result in lighter, less painful periods, so it can help with some of the physical symptoms.
Another suggestion that your GP might make is something called CBT, which is cognitive behavioural therapy, and that can be really helpful for PMS symptoms as well. So particularly if you weren't all that keen to try medications, that's something that can be really helpful and you could ask your GP about. Another treatment that your GP might suggest is using some antidepressants for treating PMS, and particularly can help with the mood symptoms of PMS. Another thing that helps some women, particularly if they have more the physical sort of symptoms, is something called a hormone coil or an IUS, and that's a treatment it's a contraception, but it's also a treatment for heavy periods. And in lots of people using an IUS, it can in fact just stop periods for that time that you're using it, and that can be really helpful if particularly your symptoms are related to heavy bleeding or painful periods or bloating in the run up to periods and that kind of thing.
It's really helpful if you can bring along a diary of your symptoms and your periods, so either a paper diary or an app that shows when your periods are occurring and at what point in your cycle your symptoms are occurring and how bad they are. That's really helpful for your doctor to see.
It's so helpful for someone that you're speaking to just see how things have been over the previous 2 or 3 months and how that's related in time-wise, because one of the key features of PMS is that it is related in this time fashion to periods. So yeah, keep a diary and just bring it along with you. So if you're looking for extra information online, NHS Inform's a really good resource just to have a look at what you might be experiencing and what help is out there. I think the key message is there is help out there, so if you are struggling, don't be afraid to go and talk to your GP about it. There are simple self-help things that you can do, but there's also medicines that might help you as well, and your GP would be happy to speak to you about that.